Joining us tonight in the studio, we have Dr. Gail Dubinsky. Dr. Gail Dubinsky is an orthopedic medical doctor practicing in Sebastopol and has been for over 27 years. She provides solutions to back, neck, hip, shoulder and knee pain, repetitive motion injuries and more. And I wish I had my reading glasses. Taking the time to listen, do a thorough hands-on evaluation and considering the whole person, she offers alternatives to drugs and surgery, including osteopathic manual therapy, yoga therapeutics, and zero balancing. So welcome.
Thank you for having me on.
That's a lot of different modalities there. So where did you start?
We'll start at the beginning.
At the creation story, I actually began as a family medical doctor. I wanted to be a general practitioner, the kind that, made house calls and got paid in eggs and tamales and things like that. And after doing, not exactly getting paid in that manner, but trying to be all things to all people, including alternative things, because I had become exposed in medical school to a whole other realm of alternative therapies when I saw a flyer for a holistic health conference in San Francisco. I was at UC Davis. And so I went down, my mind was blown, and I never looked back. And I was trying to sort of be integrative. I had an integrative health center before that was a thing in the early 80s in San Bruno, which is near the San Francisco airport. And it just became a little overwhelming trying to do everything. So I just limited to what I was most fascinated with, which was the structural, the musculoskeletal. And I was doing a lot of work comp and auto accidents, and I was studying all manner of hands-on therapies, usually from a physical therapy perspective, all kinds of manual therapies and osteopathic therapies and shiatsu. I taught acupressure to nurses. It was just very eclectic. I came up to Sonoma County in 1990, and I started my practice here in orthopedic medicine in 1991. So I have always just maybe I went to the wrong professional school, or maybe I didn't know what I wanted to do 30 years ago, but it's just been a sort of a circuitous route, but here we are.
It's evolution.
Yes.
And have you always lived on the Pacific coast, or?
Yes, I'm a California, Los Angeles, San Diego, Sacramento, and here. San Francisco and here. Yeah.
Cool.
Okay, so how did you get yoga into this? Because you've got yoga therapeutics listed.
I got yoga into it. I think a high school gymnastics teacher actually was giving us yoga as stretches. And I was just sort of doing some stretching because I was a very uptight, neurologically stressed person due to my family situation. And it was just a way of releasing physical tension. And then I had a pretty horrific car accident in 1978. And shortly after that, I had two different friends of mine tell me that didn't even know each other, you should really check out Iyengar Yoga. I did. I became a really intensive student and was en route to the teacher training program. And then I noticed that I had a pretty severe neck injury that hadn't been really noticed because the car injury was mostly a back injury. So that was sort of the end of that yoga track. But I kept teaching yoga from an orthopedic perspective, and that was really a big part of my practice for quite a while. I mean, I would work, and then I would teach classes, and then I would get up the next morning and teach class, and then the next day I'd go to work, and then I'd teach class. And
you made videos too, right?
Yes, I've made 2 videos. One is for repetitive stress injuries, and that was in 1999, and then I made my Yoga for Gardeners in 2006, and that was really a hoot. So, because...
That certainly sounds an interesting one, Yoga for Gardeners.
Well, I wanted to impart my life lesson, which is don't win the battle and lose the war. And yoga is not just about stretching. It's about all the, what are called the yamas, the moral principles like nonviolence, moderation, not being greedy and trying to, do your whole yard in one day kind of thing. So I had an injury that took a lot of time and energy and money to get over, and it's always sort of residual in my elbows. So I really wanted to save the world from that. And so even just today, I told 2 patients, both women, one's 72 and one is 84, and they are, their husbands are ill and can't really do a lot in the yard, and they're maintaining these rural properties, doing things that they should not be doing. So I'm trying to just talk the moderation in all things value into them. Anyhow, so the yoga has been a huge part of my physical, mental, spiritual, emotional grounding. And I think that imparting some of those principles, not just the stretches, but also just some of the sanity aspects of the moral principles to patients is a big part of what I do.
I think that's a great idea.
Yeah.
So then you also do the zero balancing. So
Yes.
can you start telling us, when did you get into zero balancing and what is it?
Zero balancing is relatively new in my armamentarium. I first was exposed in December of 2014. I had a emergency surgery about in May of that year, and I had all kinds of like abdominal kind of adhesions and things like that. And, the car accident I had in 1978 had, started me down the path of, how to fix my ills and with yoga and other things. And so, but this back injury had really been acting up. And so a friend of mine referred me to a practitioner that did, I would say, about an 80% zero balancing session, and the rest was like Louise Hay affirmations and things like that. And it was about a 2-hour session. I drove down to Fremont, which was driving back 3 hours in rush hour traffic after a treatment, and still it held for 3 weeks. And I had never had anything last in terms of a treatment more than a couple days, maybe 3. And, it's like I don't even get massages. They don't even last as long as I'm on the table, pretty much. But I mean, there are things I do enjoy in terms of getting. Don't think I don't get self-care, but I'm just saying it was just the most profound, long-lasting. And I said, I got to get some more of this and learn about this. So I started. I didn't want to go to Fremont all the time. So my friend who referred me to that person referred me to someone else who is a physical therapist in Marin County. She's actually now lives in Petaluma and works in Petaluma as well. Her name is Linda Wobiskaya, and she became my principal zero balancing teacher. So this is 2015, and I just took as many classes as I could in as short a period of time as I could. And so that's how I came to it. What zero balancing is, it's a hands-on body-mind system of therapy, and it works to balance the structure and energy in our bodies. And it's a total integration of Eastern medicine, energy medicine, and Western anatomy and quantum physics, as it were. The originator of it is an osteopath, MD, acupuncturist named Fritz Frederick Smith, MD. He just had his 90th birthday. He's vigorous, he's vital, and he developed this technique because he came from a family of bone setters, and his father was a chiropractor, and he was exposed to healing early on, and he was an osteopath, and then he became an MD. But he was always looking for something. He knew there was something more than what he was learning in the Western paradigm. So he was studying he was a seeker. He was studying all kinds of mind-body therapies and techniques. And then he saw an acupuncture demonstration, and it just blew his mind. He goes, this is it. This is the missing link. And then he became certified. He went to acupuncture school, became certified in 5-element acupuncture, taught in an acupuncture school in Maryland. And he just developed this synergy of Western and Eastern over the decade of the 70s. And the way it got its name, zero balancing is an odd name, I have to say. People just go, what the heck is that? Allegedly, a patient got off the table and said, I feel balanced back to zero. Before there were the stresses and strains of life and things taking its toll. So that's how it got its name.
Okay. That's quite interesting.
Yeah.
So, Gail, you were talking about the core principles of ZB, that it's all these influences from different modalities pulled together. So, what would you say with core principles?
Well, there's a few things that make zero balancing, and from here on out, we're just going to call it ZB, because that's what we all call it. Make it unique. As I said, it's a balancing the structure and energy in the body. It is a hands-on technique. The client is lying on the treatment table, fully clothed, on their back. The treatments last, well, it's usually a general treatment, it's about 30 to 40 minutes, maybe a little longer, but it can be 5 to 15 minutes, it depends. When we were at the Sonoma Strong Healing Fair last year, I was giving 3-minute sitting ZBs all day, and it was amazing to feel that many different energies and bodies in that period of time. Zero balancing is non-diagnostic, which is, for an MD, it's kind of a major paradigm shift, which has been so fascinating how to integrate it in my practice. It's non-diagnostic. You're not trying to fix anybody. You, as a practitioner, are to hold your client in the highest personal regard, non-judgmental, not trying to give them an experience or accomplish any goal, as I said, not fix anything, but just through a series of touch, and the quality of the touch is critical. It's called interface. In zero balancing, we create and are constantly aware of and focusing on the boundary between us and the person on the table. We are not blending, we are not channeling, we are not streaming. And so the person feels that there's this clear boundary that's respected at all times, and that enables the client, hopefully, to relax and trust. And so many people come to treatment with so many issues and so much trauma and so much history of adverse events, shall we say, either in childhood or adult, trauma of all kinds, physical, emotional, spiritual. And so the whole thing of connecting to the client's inner essence, which in ZB terminology, we have a whole vocabulary, but we call it the donkey. So we call it that donkey connection, because the donkey, I've never seen this myself, is that they kind of lean in to each other. Like if they're walking down the edge of the cliff, going down the Grand Canyon as pack animals, allegedly, I've never seen this, but people have seen this, they lean into each other, and people have tried this, going up to a donkey and just kind of hanging out and kind of leaning against them, and the animal, if it trusts you, will lean into you. So you want to let the person be able to really trust, and you want to connect that instinctual person. What touch feels good? So I said we're connecting structure and energy. So some people like their inner donkey likes a more structural touch, a firmer touch. Other people like a lighter, more energetic touch. And sometimes in the course of a treatment, you can vary your touch. And so basically, most of the work is done by contacting the skeleton. Now, there's a lot of talk about the fascia. Fascia is a really big thing now. Everyone's into the fascia, and the fascia connects everything in the whole body. And yes, that's true. And the fascia does hold our personal history and our experience. But the skeleton holds things that are deeper. The skeleton holds ancestral energy. The skeleton holds the very early conditioning and experience. And traumas can often get very deeply embedded in the skeleton. And the parts of the skeleton that we really focus on are what are called foundation and semi-foundation joints. These are the joints that we don't have much kinesthetic awareness of and cannot move ourselves because they don't have muscles that attach them. They just have ligaments, such as the cranial bones, the joints between the cranial bones, the sacroiliac joints, the joints that connect the ribs to the spine, things like that. And then and then the carpal bones in the wrist and the tarsal bones in the foot. You cannot move your cuboid bone selectively or your navicular bone in your wrist selectively. So these are all bones that don't get motion individually. The semi-foundation joints are more like the sternoclavicular joints and some of the other rib joints that have a little more motion but still don't really have independent movement. And a lot of energy gets stuck there. And the rib cage is just this gold mine of held energy, and we call it bone gold. That is the terminology. And so the fulcrums, which we apply, and a fulcrum is something that can be balanced around. So we slip our hands under the person, and then you just kind of curl your fingertips up into the ribs. The touch is almost always on the skeleton, although there are some soft tissue contacts that we make. And if you're not doing a pressure fulcrum, as I just described, there are also traction fulcrums, and you can do a curved pull, which we call a half moon vector. You can do a straight pull, or you can even do a compression. So, for example, picking up the heels, wrapping your hands around the Achilles tendons, and then gently doing a curved vector through the legs gives you a lot of information. I use it just in a medical exam because if someone has something going on in their sacrum and their lumbar that's acute and inflammatory, that will not be pleasant to them. But if they don't have anything like that, it's really a lovely sensation. And it also, the weight of the legs, the whole sense of how far up you can feel the energy coming to you or not, it just gives a lot of information. So the practitioner is constantly paying attention to what they're receiving through their fingertips, monitoring the client. There are things called working signs where if the person is going a little bit deeper into a state of integrating the energy shifts, because when you apply the fulcrum or the traction, the body reorganizes itself. So I'm not saying, I want to make this leg length equal, or I want to make this sacrum open up. I'm just applying the fulcrum, and the body does what it does.
So what kind of conditions does this work for the best? Because what you're telling me, it would be, because it sounds amazing, would be like a sciatica problem, something where the body's locked up, usually from a tension, stress, previous injury, and now needs some help loosening up and getting balanced again. Right.
Well, the thing with zero balancing, you hear people say things that I think sound a little arrogant, like every disease is psychosomatic and every injury is, energetic and in the body and in the mind and all this. But tell that to someone who, has sciatica or can hardly walk because their back is in spasm. Yes. But zero balancing is fantastic for more chronic things that may have a deeper, even unknown, unrecognized emotional component. I have heard so many stories and read so many case histories of people that have, in the course of a treatment, suddenly had a memory come up that they had no recollection of. They hadn't thought about it ever, or maybe not for 40 years. Mm-hmm. And we can get to that later about things surfacing and trauma and all that. But so basically, it can help, symptoms when there's a lot of blocked or excessive energy. So, headaches, backaches, fatigue, depression, anything related to stress, sleep trouble, insomnia, people that just can't be in their body, people that are really anxious. There are some things that we should not do zero balancing for, and we can talk about that in a little bit. But basically, it also just does an attitudinal or just general shift as a recipient. It's hard to put in words. You get off the table and you just feel, I wouldn't say I feel like I'm zero. I feel like I'm just smooth and homogeneous, as opposed to just peaks and valleys and sharp points and holes and things like that.
Well, I noticed that when I get stressed out, I hold my body differently and it just becomes contracted. And
that's usually what happens. No, not very many people expand when they're under stress.
So how do you use this in your practice? Because you're orthopedic medical doctor. Are you still doing that? Or
yes.
Do you integrate the ZB into your sessions with your clients?
Yes and yes. It depends. Some people come to me and they just get about every 3 or 4 week session that's pretty much a pure ZB. Now, I am trained in other things. There's another osteopathic technique that I use a lot called counterstrain. And sometimes if I find, say, like a rib that's really got a lot of bone gold in it and it's really stiff and it's really tender, and after 3 or 4 passes, because there is a protocol more or less, you have some room to wiggle and improvise, but there's basically a sequence that is followed. And if after I've made a few passes, that hasn't budged, then I'm going to go back and take another tool out of my toolbox and try to do a positional technique or a myofascial glide on that point, just to kind of get it to help, because then that's going to involve the fascia more. But there are some expanded zero balancing techniques of visceral technique and cranial technique that start to blend with these other osteopathic techniques. So I still have to do my doctor stuff. I'm supposed to diagnose. I'm supposed to fix things. So it's a kind of an interesting schizophrenic kind of situation. But some people if they just get a half moon vector, just in the case of in the context of the exam, they get a half moon vector through the neck. Oh my God, that is heavenly. A little bit of an occipital pull. So people will get elements, but they may not get a full ZB. But I think the thing about the zero balancing that's changed my practice completely is that I just want to make sure that everyone that I'm laying my hands on is getting a sense of an integrated session, that they're not just being poked and prodded, that there's a beginning, middle, and end.
But in saying that, just to make sure, this isn't a one-session thing.
No.
And see, a lot of people do think, oh, I can just go have one session and my whole body is going to be straight again.
I'm not that good.
I don't think anyone
I'm not sure anybody is. Yeah. I think that, you want to know, I would say to people, I tell people, 3 sessions, you'll know whether this is making an inroad in your problem. Some people get off the table and they feel amazingly different. And other people, it sort of takes a little while to sort of figure out. And, but I'd say that in like the 3 to 4 week interval, if it's an acute problem, every couple weeks or every week, maybe, not more often than that.
Oh, okay.
Yeah.
That's not bad.
It's not like a chiropractor 3 times a week kind of thing. No.
I've done that often.
No. I don't think the body has time to integrate between sessions.
So have I. I've done chiropractors 3 times a week, and actually sometimes twice a day for 3 times a week when I'm in serious trouble. So we've talked about some of the, I'm going to say it completely differently, some of the ZB work you do. Are there any contraindications or precautions that you need to take into account when working with people? Or who wouldn't you work with, shall we say?
Well, not to state the obvious, but you don't want to do a zero balancing session on a person that's acutely ill. You don't want to do a zero balancing session on a person who has worrisome symptoms that would mandate that they go to a doctor, like bleeding from orifices and weight loss and things like that. You do not want to do zero balancing right after surgery. Depending on the surgery, you need to wait up to 3 months, perhaps. Hip replacement or other joint replacements, you want to wait 3 to maybe even 6 months. I've had people that had hip replacements and were itching to get their zero balancing, and I think I really wanted them to wait. Like for a hip replacement, there's a hip fulcrum where you actually traction the hip and then put a little spiral into it. That was more of an energetic fulcrum for that person. Mm-hmm. But there's no reason why a person with a hip replacement couldn't get a half moon vector through the neck, but you just have to exercise caution and restraint. A person who has had a broken bone, depending on the bone, you want to wait 12 weeks, 3 months till it's healed.
Okay, so you're just trying to get everything set prior to applying any pressure.
Or just even the energetic input, or the system may not be ready to reintegrate when it's still busy trying to heal a surgery, okay. heal a joint replacement, heal a fracture. The most serious contraindication actually is the first trimester of pregnancy. You do not want to do a ZB. And then, of course, if people don't know they're pregnant, this happened with me with one of my patients. She was kind of trying to get pregnant, but she probably had a ZB and then found out she was pregnant. Well, no harm was done. But once you know, because you're dealing with 2 energy bodies at that time, and it becomes confusing. And I think there's always a risk. Everyone's so afraid to not do anything that could possibly cause a miscarriage, and
right.
So, and then caution in the case of pregnancy after that, and then you can't be lying on your back when you're late in pregnancy anyway. Someone has advanced cancer. It really depends on if they're really debilitated and have osteoporosis in general. But if they have bone mets or osteoporosis, that's probably not a good idea. You just want to be better safe than sorry.
Mm-hmm. Well, actually, that's understandable.
Yeah.
So who can train in ZB? So is it only for MDs? Is it
No. The MDs are probably a minor population in this group. You have to have a license in a health field, and I wasn't sure whether that included psychotherapists, but it does. So
Okay.
you have acupuncturists. You have lots of acupuncturists, and they're in a totally, as you can imagine, through the energetic portal. Then you have physical therapists and doctors and massage therapists, but you can have psychotherapists and MFTs and people like that. Yeah. And the program is the Zero Balancing Health Association has courses all over the country, and you can be certified or not. A certified practitioner has just had a more complete training, and they are on the website as a referral practitioner.
Okay. So what kind of results do you see? Because you've already said, okay, this needs a few sessions. What does it look like at the end? And you've got the beginning, you've got sort of the middle, and the end.
Okay, so I am a orthopedic doctor, so I tend to get people that have primarily the so-called structural issues. But, everyone's got stuff going on in their lives, and everyone has emotional things going on. And so people feel less headaches, they'll have less muscle spasms, their pain will be reduced, their symptoms will be reduced, they sleep better, they're less anxious. They feel just a better sense of well-being and less stress and less anxiety. I was just ridden with anxiety about a month or 6 weeks ago for about one or 2 weeks. I don't know what the heck was going on. And I had a zero balancing I performed on me. I mean, I got one, and I just instantly was better. There are people that work with children, and they've had amazing results with autism, learning disabilities, all kinds of emotional trauma that gets released, depression. It's just a really wide-ranging technique.
Okay, so you said children. I actually hadn't thought of that. How young can you go?
Well, my teacher does it on babies.
Wow. Okay.
Although she does a lot of cranial, but you can do the ZB expanded visceral, the abdominal stuff and the cranial and other stuff on babies, children. The sessions are short with children, 20 minutes maybe, 15 minutes.
Okay, just because I don't know, and I've had cranial sacral work done on myself. How is this different than that? Because that's moving, as a geologist, we know plate tectonics, and that's the way I kind of look at it.
That's exactly a good way to look at it.
The skull is like plate tectonics, and you're moving those plates.
Mm-hmm.
So is cranial sacral and the ZB that's done on the cranium similar?
Well, the teacher that developed the ZB cranial was an Upledger and Institute cranial instructor for decades. So it is basically informed and arising from that. But it uses the ZB principles of the interface touch, which is much lighter on the head. And there's a lot of just balance and hold. As doctors, we're supposed to do stuff and fix stuff and move this bone to that place. And if the bone is in this position, you have to move it to that position. And, that gets me into a part of my brain trying to figure out, first of all, where it is, and then second of all, what to do about it, where I'd rather just put my hands on the head or anywhere on their body, feel what it needs, feel what it's doing, feel what the energy or even the inherent movement of the organ or the cranial bone is under my hand, and then just see. I just like, and just from a standpoint of, I like to go into ease myself. It just sort of spiritually just suits me better. It's a better growth experience for me, not to just be pushing my will against something, but going to what something wants to do, let it be there where it's in ease. And so, there's cranial techniques from osteopathy that are very direct, that are, if it's stuck this way, you just push it to get it out of that way. And my body doesn't respond to that at all, because I have a kind of a contrarian personality that doesn't want to be pushed around. So, and I think I'm not the only one. I think it's a nervous system response. Like, you don't want to be challenged in that way. So, it's just, It's different. The cranial work in zero balancing is similar to the up ledger, but it's light and it has different principles.
Okay. Can ZB be used for releasing trauma?
Oh, absolutely. That's what happens whether you're trying to or not. And the way trauma releases, sometimes, you don't have to live through the experience again necessarily. You don't even have to remember. There are lots of case studies, and there's a whole book on zero balancing case studies out now. And people will just be suddenly be flooded with an emotion, and it won't even have a story. It's just an unscripted emotion of sadness, of just a tremor of fear perhaps, but mostly grief or sadness. You won't know why. And then you just encourage the client to just feel it moving like an energy wave. Don't write a screenplay about it, and it will pass. And people often do not even know what it was. Other times people will have a flash remembrance of, oh my God, when I was 5, my brother, this happened in a class where one of the teachers was being worked on by the other teacher, and we were working on a coccyx release, which, as you can imagine, is just very gentle. You're just basically just barely contacting the coccyx and just gently putting little fulcrums into it. And she had this whole memory. She grew up in England, and her brother was a bully, and they would climb trees together, and he pushed her out of this tree. He did this more than one time, but they were really high up in this tree this time, and she fell down on her coccyx and really hurt herself. And she had just not really thought about that because I guess he was such a, crummy person for so long. There were so many other incidents to think about, and she had not thought about that for 40 years. And it just came up right then. And then she realized why she had this real resistance, as I do, to being pushed around, both physically and just, behaviorally. And so you can have these instant awarenesses, but it doesn't have to be like that. And, the trauma, the earlier the trauma we've had, the deeper it is in the bones or in the skeleton. More recent trauma is more lodged in our more superficial layers, and that usually peels off first.
Okay.
How do people get into this? How do people find you? And allied questions like that one.
Okay. Well, I'll first say how you find zero balancing in general in terms of finding a practitioner if you're listening somewhere other than locally. Zerobalancing.com, that's not very hard. It's the website of the Zero Balancing Health Association, and they have actually a nice video where Dr. Fritz himself, we all call him Fritz, but Dr. Smith has, it's maybe about 20 minutes where he just explains the theory, how it works, does a little demo. So that's very useful and elementary and gives a good background. They have the most valuable resource for a person that's not a practitioner but looking for a practitioner is the practitioner guide, where you put in, your zip code and state like it always is, and then you find people that are certified in the area. So there are a few certified people in Sonoma County, of which I am one. And if you want to get in touch with me, my name is Gail, Gail Dubinsky, and my website is gaildubinskymd.com. And I'm in Sebastopol, the same office for 27 years. And my phone number is 707-829-7596. And you will always get a voicemail unless I just happen to be sitting by the phone because I'm a one-woman shop. But I will always call you back, or you may email me, and my contact information is on my website. But again, that's dubinsky@rxyoga.com.
Well, thank you very much. This has been very enlightening. I didn't fully understand
what you got.
What I got. That's right.
But you knew you felt different afterwards.
Yes, I did.
And that's the point. There's an elevation, there's an integration, there's a release of so much stuff we don't have to be holding on to.
Well, before you leave, I will say I have had a session with Dr. Gail and for sciatica. And what was interesting to me was when I got up off the table, I went, I don't feel pain. That's not normal. And that lasted a while, and that was very. It was very unusual not to have some pain and feel lopsided, because that's what sciatica does. It just makes you feel a little bit lopsided.
Well, we definitely need to build on that then.
I know.
All right. Thank you so much for having me.
Well,
It's been a
thank you
pleasure.
for joining us.
One quick last question. I'm assuming that this is available globally.
Yes. Some places more than other. There's a big community in the UK. There's community. Oh, Switzerland, I think, has a huge. Well, it's a tiny country, but it has a lot of people doing zero balancing. It's in Asia. It's worldwide. Yes, and if you go to the website that I mentioned, therozerobalancing.com, you can see where it is.
Excellent.
It's everywhere.
Very good.
Well, not everywhere, but in many places. Yes.
Excellent.
You know
Thank
where
you.
it's not very much? There's not very much in Southern California, believe it or not. Yeah.
How strange.
Yeah.
Because I can't imagine they're not stressed out a little bit too.
Oh, they have other ways of dealing with it, I guess. They've got Gwyneth Paltrow's Goop and all that stuff. There's a big community in Tucson. That's kind of close.
Well,
Thank you so much.
Thank you very much indeed.